Yeah. Thank. Thank you, Anthony. Good afternoon, everyone, or should I say good morning to the panelists for joining this webinar. And thank you again, Anthony, for moderating the event, which is co-hosted by the Committee for Interparliamentary Cooperation of the Indonesian House of Representatives and the Westminster Foundation for Democracy. So we have a very close relation for democracy and the governance for a long time between WFD and the Indonesian House of Representatives. It is unfortunate that we have to meet in such a virtual manner, but I do hope this event will bear fruit to our parliamentary work during the pandemic. So today's webinar has its significance to the way our parliament exercises its functions. We have seen how COVID-19 created not just a global crisis in health, but also in the economy. To date, at least around 100 countries are experiencing economic adversity and have called the International Monetary Fund, the IMF, and or the World Bank for some backups. So some countries even seeking more resources from the other debt markets. At anywhere all around the world, governments are now allocating a big portion of their public funds to be distributed to a number of impacted sectors, ranging from health, businesses and economy, and even social safety nets. So the sudden wave of funds, goods and services to these sectors may potentially create opportunities for fraud or even misallocation of resources. So our job as a member of parliament in managing such a huge flow of public funds is to ensure that nothing goes wrong with the policies and the funds during the time of crisis. We have a crucial role in ensuring that all government's COVID-related policies implemented in a accountable, transparent, and inclusive manner. So, but the challenges in exercising this parliamentary function during the pandemic is twofold. First one is regarding the parliamentary operation due to some restrictive and distancing measures taken to contain the coronavirus. And second one is about the accumulation of authority the executives have in the name of emergency power. So I know that in some sense we have passed the first challenge. Some parliaments continue to operate by physically present at the parliamentary compound. Some have changed their rules of procedure to embrace a virtual deliberation, and others adopt a hybrid one, a combination of physical and virtual meetings. The second challenge is the delicate one. We have seen that many authorities look up for a workaround to grasp more power for the sake of swift, efficient, urgent, and effective response to mitigate the pandemic impact. In some countries, emergency power even comes at the expense of parliament. Questions are therefore looming. What is there to be left for parliament if most of the power accumulated in the government? Indonesia, for example, the adopted government regulation in lieu of the law number 1 2020, now is the law number 2 2020 on coronavirus crisis management, has mandated the government to devise changes in 2020 state budget without prior consultation to the parliament. So this surely provides challenges of parliamentary oversights, both in term ex ante and ex post oversights. How we can ensure that all fiscal measures, immediate fiscal impulse, deferral, other liquidity provisions and guarantees, for example, are formulated to serve the best interests of people that we are representing. What are the merits? How parliamentary assessments and approval of the new debts of international financial supports are being exercised, as these are crucial to ensure that our actions today do not cost our people for generations to come. So the exposed parliamentary oversight is no less important. This is a great deal because trillions of money have been and will be disbursed and spent by the government to counter crisis, we need to work to ensure that the spending of these funds is done in a timely, reliable, accurate, accountable, transparent, and efficient manner. So we have to make sure that incentives provided by the government can boost the economy, especially those with small and medium businesses, and maintain and even promote more jobs. Parliament should also verify whether our social safety nets are adequately provided and accurately targeted during the crisis. In addition to that, the increasing fiscal stimulus should not be used for a rent-seeking activity by those irresponsible individuals or groups. Transparency is of paramount importance. These kinds of issues are challenging, and of course, it is always wonderful to hear perspectives, shared lessons learned, and best practices from other parliaments in their way exercising financial oversight during this difficult time. So I'm happy to hear that our panelists today are to some extent representation from inclusive and diverse groups, ranging from the opposition, the women, the youth, and also from the Public Account Committee membership. I have the honor to introduce you to Mrs. Putri Kamarudin, a bright young Indonesian parliamentarian who is now a member of the Banking and Finance Commission. She's also a member of Committee for Interparliamentary Cooperation. So with her as a panelist, the discussion will be filled with fresh and new perspectives from the young parliamentarian side of you as well. So I'm looking forward to hearing and discussing more with all of you in terms of financial oversight during pandemic, especially with how the Public Account Committee is working as the Indonesian House has re-established its share of Public Account Committee in 2018. I have no doubt that this webinar shall serve its purpose to facilitate interparliamentary discussion in a way to strengthen financial oversight in response to COVID-19. So I appreciate the Westminster Foundation for Democracy for its partnership in the preparation of this online discussion. Let the partnership between both the House and the Westminster Foundation for Democracy be strengthened in the coming future with a view to promote democracy and governance and embrace the culture of openness. Thank you. Thank you, Anthony.
Thank you very much indeed for that excellent welcoming remark. And you've touched on all of the key things that we want to do. Like you, I am very proud of the cooperation that we've had between the Foundation and your committee. And I think we both agreed that having an opportunity to hear from lawmakers in countries across 4 different regions and with the diversity that you described would be very helpful to all of us. So let me start now by introducing the excellent panel. And you have already mentioned your compatriot Putri Kamarudin, who is a member of the Golkar Party and was elected to the DPR, the House of Representatives, quite recently in October 2019. She is a member of the Finance Committee of the DPR and, as you indicated, has a strong qualification to be chair of the Youth Caucus in the DPR. We also have Jordan Hill-Lewis, who has been a member of the South African Parliament since 2014. And he is a member of the Democratic Alliance Party there. He is very well versed in these finance issues and is the Shadow Minister of Finance for the DA party in South Africa. We have also James Wild, who has been a member of the UK House of Commons since December 2019, so the most recently elected member. And I can't help mentioning that he succeeded in his constituency of Northwest Norfolk, Sir Henry Bellingham, who was, until relatively recently, the chair of the board of the Westminster Foundation for Democracy, and he is a member of the UK House of Commons Public Accounts Committee. And then finally, we have, I'm very pleased to say, Dr. Inaya Ezzedine, who is a member of the Lebanese Parliament, where she has sat since 2016. She is a medical doctor and has studied both in the UK and the US. And she is chair of the Women and Children Committee of the Lebanese Parliament. So a very warm welcome to all of you on the panel. As I said at the beginning, we will have some questions for the panel that I will moderate first to start the discussion, and then we'll have time for some questions and answers at the end before closing. And just to start, to give everyone the opportunity to understand, to help the panelists understand the conditions that they've been working in during this crisis, it'd be very interesting to hear a little bit about the impact of the crisis on your working environment. I'm sitting, actually, despite my background, I'm sitting in Scotland. It's been 16 weeks, I think, since the office of the foundation in London closed. And at one point, all of our 33 offices around the world were closed, and we're still mostly working remotely. Could I just ask each of the four panelists to say very briefly, maybe in 60 seconds, where you are speaking from and whether you've had to adopt new working practices as a result of the pandemic? I wonder if I could start with Inaya, Dr. Ezzedine. Perhaps as a medical doctor, you've been particularly affected by the heart of the crisis, the health pandemic. But Inaya, could you say in 60 seconds where you are, where you've been, and how you've had to adapt? Don't forget to come off mute before you speak.
Let me start by saying that I became member of parliament since May 2018, not 2016. Right now, I'm in my private office, which is not far from the Lebanese parliament. On the 15th of March, the Lebanese parliament shut its doors because the government proclaimed a state of health emergency and general mobilization that led to the closure of all institutions, public and private. Also, all the MP offices were closed. 2 months ago, we reopened the parliament, but just for 3 venues where the committees can meet there, the different committees. But we held 2 General Assembly meetings in an amphitheater in the city of Beirut. The capacity of that amphitheater is around for 1,000 individuals, so there we could take enough physical distancing and respect all the health and safety measures that were needed by public health authorities and by the WHO. Now we go every day to the parliament to attend our committee meetings, but as I said, in only 3 big venues in the parliament.
Thank you very much. Maybe I'll turn next to James in the UK to hear a bit about your experience. You hardly got to spend much time in Parliament, I think, before the pandemic hit. Again, I think you're on mute, James. Yeah.
Apologies. I'm in my office in the House of Commons, so I'm having a few Wi-Fi issues. So I've dropped off a couple of times, but I'm now on my phone, so fingers crossed. Yeah, no, I was elected at the end of December, so we had about 8 weeks, I think, before Parliament went into lockdown. And then for most of the period of lockdown, I was participating in proceedings via Zoom. Parliament sat virtually, which was a huge effort to get technology up and running. It wasn't a particularly strong part of the parliamentary system before that. But we're back. We've been back for about a month. just the MPs and members of the House of Lords. Our staff are working remotely, so I have daily Zoom calls with them. But it does limit, in terms of the House of Commons chamber, we're only allowed 50 MPs in at any one time out of 650. So that requires having essentially a lottery every day to see who gets to ask questions and who can speak in debates. So we've lost some of the ability to walk in the chamber and participate in debates freely. You have to be on a list. So some of that spontaneity is gone, but it's definitely better to be back here. And I think it's important as parliamentarians to show that we're back in our workplace when we're asking others to do so. So yeah, I've had a slightly unusual introduction, but it's beginning to get back to a bit more of normality, certainly in terms of being actually in the Palace of Westminster.
Great, thank you very much for that description. Jordan, in South Africa, it would be great to hear a bit about the circumstances that you've been working in over the last few months.
Thank you very much, Anthony, and thanks for your introduction. And it's a pleasure to be with you and to see all of the colleagues from around the world. I'm speaking to you from our house in Cape Town in South Africa, where we have been in various stages of lockdown for about 105 days now, since late March. Lockdown has been significantly relaxed in recent weeks in South Africa, but we are still not returning to work. Everyone who can work remotely needs to do so. So Parliament is sitting just once a week in the chamber, and only for those who are living in Cape Town, where the seat of Parliament is, and who can travel to the chamber. So I'm going in once a week. That's today. Later today, after this discussion, I'm going into the House. And everyone else, all of the other members from around the country are joining via Zoom and working remotely. So that's how we're doing it, but it's a pleasure to be with you today.
Thank you very much, Jordan. And lastly, Putri, could you please tell us a little bit about the practical impacts of the crisis, how it's affected your work? You need to unmute.
I'm sorry, we have some, technology is not actually our best friend. And thank you, Anthony. Once again, hi, everyone. I'm speaking from the Committee for Interparliamentary Cooperation in the House of Representatives of the Republic of Indonesia, that is based in Jakarta, our capital city. And the Parliament is actually in session until the second week of July. And under necessary circumstances, and such as today, we're still able to maintain physical presence in our office in Senayan. And it is done with careful consideration and under strict protocols. So I believe happens in all other countries as well. And leaving for work to the office is now permissible as Jakarta adopted transition status to gradually ease out the large-scale restriction policy. And however, the majority of our works is now still done through virtual presence, and similar to what James and Jordan and Dr. Inaya has mentioned just now, we're still adopting and adjusting with the visual and virtual type of parliamentary sessions. Yeah, and once again, thank you.
Great, thank you very much. Now let's turn to the core of the subject of this webinar, which is the aspect of financial oversight. And Fadluzon said in his opening how extraordinary the measures have been that governments around the world have had to take. And I think in the House of Commons today, our Chancellor of the Exchequer is announcing more measures. So the extraordinary amount of government support in a very short period of time has been something that parliaments have had to respond to. And it'd be interesting to know whether your parliaments, do you think they have been able to rely on their normal mechanisms for financial oversight, or whether you have had to develop new mechanisms for tackling this problem? And I wanted to start with James to ask how the UK Parliament has conducted financial oversight of the spending. and in particular, obviously, the role of the Public Accounts Committee that you sit on, and then I'll come to the others after that. You're on mute.
Sorry. I'll get it next time. Sorry. Thank you. Yeah, we're obviously dealing with unprecedented scales of economic response to this crisis, and in terms of the Public Accounts Committee that I sit on, which is the main value for money committee within Parliament, we've certainly prioritised looking at the COVID-19 related issues, whilst also continuing to look at some other matters that are important, such as defence spending, which involve a lot of public spending. We've been limited in, normally as a committee, we would sit twice a week with 2 sort of 3-hour hearings with witnesses. But due to technology and sitting, although we're here physically, our committees are happening virtually. So we're limited to 1 meeting a week, which has had an impact on our ability to scrutinise. But we have looked at the key spending areas, the business support, the health response, as well as funding for our local authorities who are on the front line of response. And we've adapted by bringing in chairmen from other select committees, so the Health Select Committee or the Communities or the Business Committee, and having their chairman sit as a member of our committee when we're interrogating the senior officials. We have had, I think, to be mindful that the scale of response and the number of issues that government officials are dealing with means that we need to be smart about calling them in to take them away for 3 hours from other work they could be doing. But given the scale of response, over £100 billion of support has been provided in the UK, we do need to scrutinise that. There's been a lot more instances where ministers have directed officials to spend money where they haven't been able to say that it will be value for money, and we'll definitely be coming to look at those areas of funding in more detail in slightly slower time. I think we need to allow government ministers and officials to get on with providing the support, and then we can do the value for money assessments that will hopefully inform, if there were, which we all don't want, any form of second wave, and make schemes more effective.
Thank you very much, James. Can I just briefly ask a follow-up question, just to understand the role of the Public Accounts Committee versus the role of, say, a Finance Committee? Are you often questioning Finance Ministry officials, Treasury officials, or more usually the line ministry, people from those that are implementing the programs and the spending?
Yeah, so the remit of the committee is to look at the efficiency and effectiveness of public spending, so the value for money. So we have, our witnesses are the accounting officers from within departments, so the individuals who have a duty to our Parliament to account for all the money they spend. So we don't interrogate ministers, we interrogate the officials.
Thank you very much. Now let me turn to the others. Putri, I wonder if you could say a little bit, because you are on the Finance Committee, about whether you have been able to rely on your existing procedures or whether you've had to adopt new procedures in light of the crisis.
Yeah, COVID-19 udah di-unmute belum? Udah. COVID-19 has created unique challenges for legislators, not only in Indonesia, but I believe in the world over. And I can say that with the assistance of technology, we have been able to adapt to the emerging reality of the COVID-19 pandemic. As soon as the government declared the first cases in early March, the House of Representatives responded by imposing the work from home measure and arranging virtual committee meetings to enable us to carry on our oversight function on behalf of the citizens. And on-screen communication certainly has its drawback compared to face-to-face communications, and some messages may be interpreted differently or disrupted by signal loss during transmission. However, as time goes by, we managed to adjust quite well, at least trying to adjust well. And considering the situation we are in now with the new COVID-19 positive cases still apparent, maybe you have heard about the cases in Jakarta. we still have to maximize our functions through virtual meetings or a mix between virtual and in-person meetings if necessary. And regardless of the form of communication, we believe that it does not hinder the Parliament's role in overseeing the country's financial affairs, especially at times like this. And throughout these meetings, we still manage to maintain two-way and timely communication with government institutions and also related authorities. And we're also able to hold off-session meetings with the government and related authorities to discuss monetary and fiscal policies that has become more adaptable due to the highly volatile market condition. And therefore, we also have been pushing for more adaptive, workable, and forward-looking policies.
Thank you very much, Putri. Jordan, can I turn to you? You have what I always think is a particularly difficult job during a crisis, being in the opposition and needing to both scrutinize and perhaps support the government. And your portfolio is touching on maybe the critical issue, obviously, after the public health aspects of how the country affords to take its response forward. Do you feel that you've been able to use the normal parliamentary mechanisms effectively, or have there been weaknesses in your ability to rely on Parliament to scrutinize?
Yeah, thank you for that question. I think so there's been some practical difficulties, and then there have been some political difficulties as well. The practical difficulties are ones that I'm sure everyone on this call is familiar with. Obviously, we have had limited engagement with the minister and departmental officials because we're doing it over Zoom and MS Teams. And so ordinarily when one would have a full day engagement to quiz and question and interrogate the minister and his officials, we only now have a couple of hours to do so. So that limits the scope for accountability and oversight quite significantly. And that's a practical problem. But in the early stages of the lockdown, the government relied on a declaration of disaster. And that meant that, can you hear me?
Yes, you dropped out. You dropped out for a second, and then you came back in.
Okay. So in the early stages of the lockdown, the government relied on a declaration of disaster to give them powers to issue regulations at will without legislative oversight. That's obviously very dangerous, but for reasons of this crisis, we thought it was prudent and acceptable to support it up front in the early stages, the first 2 or 3 weeks of the lockdown crisis. But after that, it became apparent that the government was issuing regulations nearly on a daily basis on the lockdown. And some of those regulations were very poorly thought through. The implications of them were very awkward and cumbersome for society to comply with. And it was clear that they had been rushed. And there it became apparent that parliamentary oversight was very necessary. And so we had to start to reassert ourselves as a parliament to say, actually, you can't be issuing regulations on a daily basis which have the force of the full force of law and legislation without parliamentary oversight. And so there was a period at the beginning where I think Parliament failed in its duty and was not muscular enough in asserting itself. But I would say probably a month into the crisis, Parliament did start to reassert itself, and I think the effects have been positive since then.
Thank you. Just to follow up on that, I mean, it's an interesting context is different in every country, and sometimes the parliament is very tied to the government position and perhaps doesn't assert itself as much as it could. But is your feeling that in South Africa, the parliament itself understood the importance of its role and made that clear even among the government members?
as I say, I think at the beginning, in the initial phase, there was a failure. And I mean, you are quite right. I'm sure this is the case in many developing countries. There is an incredible deference to the executive in South Africa by Parliament, by the courts, by civil society. So there's an assumption of there's a deferential, of course, unhealthy. But as I say, about a month into it, I think even governing party members could see that the regulations were having some terrible consequences for society, and some just embarrassing. Just very messy and poorly thought through and badly implemented. And if the government had taken a moment or two to discuss those regulations more broadly or to put them through the parliamentary process, they would have been of a far better quality and far more implementable. So once that started happening, and there started to be some public pressure building around the consequences of these regulations and the effects that they were having, particularly the shutdown of businesses and all of the sometimes very arbitrary rules that businesses had to comply with in the shutdown, then public pressure started to build on the government to subject itself more thoroughly to proper oversight, and that's when Parliament started to assert itself.
Thank you. That's very helpful indeed to get that flavour. Inaya, could I turn to you now? Sticking just to the financial oversight elements, your committee, of course, is focused on groups who are often vulnerable, and we will talk later in a separate question about some of those impacts. But could you say a little bit about the role of your committee in financial oversight of the spending, of its effectiveness during this crisis? And don't forget to come off mute. You're still on mute.
I cannot only talk about the role of my committee, the Committee for Children, Women and Children and Financial Oversight. We were all going through the untraditional mechanisms to exert this oversight. I happen to be also a member of the Health Committee and of the Environment Committee. So my role was between the membership and the chairing of this committee. Actually, as my colleague from South Africa mentioned, in the beginning of the crisis, everybody was taken by surprise, and I can say that the Parliament was more or less passive. I think this happened in a lot of places and in a lot of countries, and it took us 2 to 3 weeks to regain our momentum. With the lockdown and the shutdown of the Parliament, we decided to go ourselves physically to the Minister of Health. So the committee of the Health Committee and few of the members of the Women Committee, we used to go maybe every week or every 10 days to the Ministry of Health to assess and to ask and to see how much money of their budget that has been approved early of this year is being allocated according to priorities to deal with the challenges of the crisis, and how much money is proportionately spent according to the prioritized needs. Because we discovered that the private sector, which has the biggest share of the spending of the government during ordinary day, was not engaged in the management of the crisis. And we had to rely mainly on the public hospitals. So we had to make sure that 12 public hospitals in the different regions of Lebanon are going to be provided with the necessary equipment to meet with the anticipated numbers of COVID-19 cases. Also, we discussed with them, we have an economic crisis prior to the pandemic. How much money would be needed, extra money, other than the budget, to meet the needs? And this is the other way around. We were discussing them and then proposing that they send us a draft. We had to redistribute a World Bank loan that was that was committed for the primary health care, we had to move $45 million from the 120 loan to meet the needs of the hospitals all over Lebanon and the testing and the confinement. Of course, we don't have, unfortunately, we don't have this gender disaggregated data in a lot of sectors, but I can tell you that the committee and I myself urged the Ministry of Health to allocate a fund to deal with the pregnant women who will contract the disease. We know that pregnancy by itself is not a risk factor, but once a pregnant woman has the infection, she has to be dealt with in a special way, especially when she is about to deliver. And this we succeeded in doing. We did not succeed in allocating yet because a gender-sensitive economic agenda for after the pandemic. Later on, you have, as you mentioned, a question about what we could do with women issues that resulted from the crisis, like gender-based violence, like dismissal from jobs, like cutting short salaries. In some aspects, we could do a little bit, but we did not find optimal solutions so far.
Thank you. Well, I think
sorry, I failed to mention that the government also allocated an extra. We in the Parliament approved a budget of 1,200 billion Lebanese pounds for social safety net and for empowering small businesses in industry, agriculture, and crafts. And we encouraged them to make it as inclusive and as gender sensitive as possible.
Thank you very much, Anaya. And I think you have very helpfully moved us to the subject that I did want to come on to, which is the fact that it seems to be clear in almost every country that the impact of the disease is not equal. And some of that seems to be a medical distinction, and some of it is about social conditions that people are in. You've started to say that a bit about Lebanon. I wonder if you could say a little bit more, but in particular, was this something that the Parliament itself was conscious of, was taking account of? Does it have mechanisms for investigating the different types of impact? And would you see this as something that your committees, I hadn't realized you were on all three, your committees will be looking at further?
Yes, I think so. We will be able to play a role. Actually, I have been very busy the last week and this week preparing for a series of hearings with the different stakeholders that have to do with women's issues and women's problems arising from the corona crisis, and how much inequality there is in the impact. Actually, there was an increase in the violence, domestic violence, and we have the internal security forces have reported increase in the numbers of these complaints. And actually, we succeeded in allowing the judges, by a decision from the general prosecutor, to take these witnesses and testimonies over phone calls, because it's difficult for women to go out of their house or even go out when the aggressor is at home. So we will have these hearings to hear from different stakeholders, and it'll be the first time that we do this type of hearing in the Lebanese Parliament and maybe in the region. We will also be hearing individuals who have been victims of domestic violence, of dismissal from jobs without any compensation, especially we have a big number of these women. They have informal, unregistered jobs. We have unequal pay, even in the private sector, even in the most prestigious banking sector, which is very strong in Lebanon. We have unequal pays, and there have been a substantial cut in their salaries. But the most really striking and painful something that happened during the crisis is in the nursing sector. We have like 80% of our nurses who were at the forefront in fighting the corona and in taking care of the patients. They are females. Because of the economic meltdown that we are going through, a lot of hospitals have to close, or they closed floors. And these nurses found themselves at home, jobless. They have to take care of their families when they are the breadwinners. They have to take care of all the domestic activities that in our culture, unfortunately, we did not succeed to make it a partnership duties, men and women. She has to take care of the homeschooling for the online schooling when she is economically deprived and their rights are being not given in a just way. And now we are trying to find ways to re-employ or redistribute them between the private and the public sector. They had to work in very miserable conditions without PPEs in the beginning of the crisis, and we had to also find a solution for this, and fortunately we succeeded. The result of these hearings will be, at the end of these hearings, we are speculating that there will be recommendations to the executive level, and maybe there will be room for some legislations to regulate these issues. I think the corona crisis, not only in this sector, but in a lot of sectors, proved to us that there should be more regulations at many levels of the policy making, and not just leave it, especially when the private sector is at stake.
That's really helpful, Inaya. Thank you very much for that. I know how much challenge there's been in your country from that combination of the economic crisis and the health crisis. I'd like to hear from the other panelists as well. I think Jordan has had a little bit of technical trouble and he's going to rejoin with his phone. Oh, perhaps you're back already.
Yes.
Great. Well, I'll maybe come to you first, then James, then Putri. But Jordan, obviously South Africa has a legacy of inequality that it's been dealing with for a generation now, and I don't know whether you have felt that this crisis has the impact of the crisis has been affected by those factors as well, whether there have been new issues around the impact of the crisis on different groups inside South African society. It'd be really helpful to hear about the Parliament's response to that, or its awareness of that.
Oh, definitely, undoubtedly. South Africa obviously is a very unequal society, and we have the added difficulty or painfulness that inequality is still largely racialized in South Africa. And the poor in South Africa tend to live in very densely populated informal settlements, what we call townships, in the cities. And it was always an enormous risk that once the virus broke out in those kind of living conditions, that it would spread extremely quickly, because people were living so close to one another, very often 5 or 6 or more people in a single room. And so there's basically no way to socially isolate and practice social distancing in that kind of context. It's not possible. And that is partly why we always felt that actually lockdown was not an appropriate strategy for South Africa. And I think this is probably the case in many similar societies. With that kind of poverty, the risk of losing a job and losing a breadwinner in a family and moving an entire family back from just barely in the working class back into poverty is as bad and as dangerous as the risk of catching the virus. And so we have seen, for example, for the first time in many, many years, in fact, our health department says for the first time in decades, we have seen a sharp increase in the number of people coming to hospitals with real hunger, with malnutrition. That has not happened in South Africa for a long time. And we are seeing those cases on the rise. So the other point to make is, of course, the lockdown forced people to use their financial savings, and lots of people lost salaries or took big salary cuts. And the wealthy and the middle class have got the savings to be able to handle that kind of pressure for a few months, or at least they have access to credit. If they don't have savings, they have access to credit. But the poor and the working class simply don't have those financial buffers, and they don't have any savings. So it's profoundly worse. The effect is profoundly worse. So I think, to answer your question directly, Anthony, there's going to be in a already very unequal society, there's going to be a big spike in inequality in South Africa as a result of this crisis. And that's very, very sad. From a parliamentary and financial point of view, what we felt from the very beginning was that, I've spoken about lockdown. I don't think that lockdown was an appropriate strategy for a society like ours. But also it was clear that the most important government response was to get cash into the hands of those people who needed it most, particularly the poor and working class, through the social welfare system. And to their credit, I think the government did also see the truth of that and immediately started to increase cash grant allocations to the poor. But unfortunately, the delivery mechanism has been very, very poor. So the cash has struggled to get into the hands of people that have needed it most. So there's been a policy objective, which has been, I think, correct, to say we've got to get cash into those people's hands as soon as possible. But it has failed in implementation because the delivery mechanism has not been able to handle firstly the weight of the number of applicants, and being able to safely and securely distribute that cash on a monthly basis to the people who need it most. So we've, for example, just to leave you with one small example, we've had about 8 million people apply for the temporary COVID relief social grant, a welfare grant, and so far, we're now 4 months into lockdown, only about 1 million people have actually received it. So there is a huge disjuncture between intention and policy and what is actually achievable in a time of crisis at great speed. And that's been a very interesting feature of this crisis for me to observe. Thanks.
Jordan, thank you very much indeed for that. James, can I turn to you now? I think the one thing certainly in the UK that's been a feature is that our National Health Service has come in for huge praise. It's access to everyone, free at the point of access. So it's not the same as a country which relies so heavily on private healthcare. But nevertheless, there are differing impacts of the pandemic on different groups. Is this something that is featured in the discussions in the Public Accounts Committee in particular? I think there has been discussion about it clearly in Parliament as a whole in all of its functions, but what about in the committee?
Yeah, thank you, Anthony. Yeah, I mean, in terms of the National Health Service, the priority here is to prevent it falling over effectively. Some other countries, unfortunately, in Europe, were overwhelmed. So that was the strategy, and that has been effective, although there have obviously been problems within the care home, social care system. There's been a lot of focus across Parliament, really, on the disparities in terms of infection rates and death rates. And there's a piece of work done by the Public Health England, the public health advisors to the government, which identified higher death rates amongst Black and Asian minorities. Also, there's clearly age differentials with disproportionate effects on some occupations that people are working in. So I think that initial phase was published at the beginning of last month, which then kicked off some further work really to understand what lies behind this and taking into account the various factors that might sit beneath it. I think the response in terms of the Parliament and the Public Accounts Committee, we haven't looked at those differences per se. We're looking at, obviously there's been hardship funding for individuals, which will be focused on, particularly in a city, more ethnically diverse groups. We're also looking at sort of some of the underlying issues like obesity and the prevalence of that within different communities, and obviously the public health, and also the impact on spending of poor diet and moving towards healthier living. So I think there's quite a lot of positive work that is being kicked off the back of that. We have an Equality Select Committee within the Parliament, which is leading in terms of looking specifically at the disparities. So we would come at it to look at the discrete elements of where, if we do more on healthy living, what will be the value for money in terms of health savings and improved age.
Great, thank you very much, James. Richard, could I turn to you as well? Indonesia is a very big and very diverse country. Is the difference in impact of the pandemic on different communities something that Parliament has been concerned about? Have you seen that impact? And could you tell me a little bit about the response?
Yeah, I have to, thanks Anthony, I have to agree with Jordan in terms of the escalating level of wealth gap post-pandemic. And in Indonesia, we believe that empowering women is actually part of the solution to fight COVID-19. So our commitment to prevent discrimination against women amid the pandemic is crystal clear, and gender mainstreaming in national development is mandatory and regulated through presidential instruction. And it is complemented with a guideline for gender mainstreaming at local government and gender responsive budgeting. And President Joko Widodo also stressed the importance of strengthening gender equality and empowering women in his second term administration. And in the House Commission on Financial Affairs, I have often voiced out my concern on the impact of this pandemic to the micro, small, and medium enterprises. And the latest was last week during a consultation meeting with the government. And in April 2020, our central bank, Bank of Indonesia, has warned us of the risk for a global economic recession in 2020 due to declining demand and disruption of the production process as the result of social distancing protocol for reducing the risk of COVID-19 pandemic. And to avoid a prolonged economic slowdown, I believe the government must intervene by creating demand for the domestic market. And one of the alternatives is by prioritizing MSMEs products in the government procurement. And 64% of micro, small, medium enterprises in Indonesia are owned or led by women, and the majority of employees are female. And 60% of the businesses that produce protective gear and masks are owned by women. And creating a market for their products will certainly provide a lifeline for their existence. And in addition, the government also provides various stimulus aimed to defend MSMEs' financial capabilities, such as loan interest payment, subsidy, and additional working capital loan. And which one of its recipients are government-owned ultra micro financing programs that were aimed to empower female entrepreneurs, where recipients have reached 8.3 million women. And by this illustration, I hope I could provide the audiences by the context that taking care of government budget and spending on micro and small medium enterprises supports women in Indonesia both directly and indirectly.
Thank you very much, Putri. That's very, very helpful indeed. Now, I'm conscious of the time. We have half an hour left, and I want to get in another question, and then the questions and answers, and then some final comments from the panelists and our host. So I will combine the next two questions into one. I was going to ask both about transparency and the importance of transparency, particularly in maintaining public trust, and also the question of debt and the fact that debt levels are increasing substantially in many countries because of public debt, I'm talking about, because of the measures being taken. I'd like to start with Jordan and then perhaps go to Inaya, then James and Putri. Jordan, I know that transparency from our engagements in South Africa in the past has been an issue that the Parliament has been interested in, as well as the government. Could you say a little bit about and I also know that debt levels are very significant in South Africa. Maybe pulling those things together, of course, it's important to have transparency in managing debt, but more broadly, the issue of transparency and the confidence that the public have in the government's response. Is that a factor for you?
Oh, very definitely. That's been the focus of my own personal work on the Finance Committee. Look, there's actually not outside of the United States, which is borrowing an enormous amount through this crisis. There's not any other country in the world that's borrowing as much as us. Now, that's not something that we should necessarily be pleased about, because we are a tiny, open economy on the southern tip of Africa, and are not really in the same league as the United States. But as a share of GDP, we are borrowing nearly the same as them. So the debt levels in South Africa are really threatening to become unsustainable, and that has profound consequences over time, because of course all of that debt must be repaid, and that means that more and more of the budget is squeezed out and is spent on debt costs, whereas it should be spent on services and support for the poor and the marginalized. So this is an issue of huge concern. One thing that we have in our favor is that South Africa has a very transparent and open budgeting process, and the National Treasury really is a center of excellence in our government that manages the budget process very, very competently and comprehensively. It is all open for public participation. All of the information is publicly available. And the government has presented a plan over the next 4 years for how to lower borrowings and get debt under control. But Anthony, what I'd like to focus on is transparency in the spending of that budget. So, the National Treasury essentially presents a budget to the country. It manages the borrowing on the global market, and then it distributes that money to government departments who are in charge of spending it. And that is where there is a great deal of concern about corruption and very inefficient spending. And so what we have proposed is a special inspector general to be appointed to oversee all COVID-related spending. There's a very significant amount of spending. As I've said, they're borrowing a huge amount of money. And a large portion of it, we know, in South Africa will be lost to corruption unless there is some very careful oversight of the spending. Now, of course, South Africa, like I'm sure every country, has got an Auditor General. The Auditor General only looks at spending after the fact, sometimes nearly a year after the fact. So the Auditor General can pick up corruption, but only long after it's happened. So we have proposed the formation of an office of a Special Inspector General for COVID spending that will oversee spending in real time as it happens over the coming months until the COVID budget is exhausted, so that he or she can intervene to stop and arrest corruption before or while it is happening. And we're very pleased that that proposal has found some support in the government, and I think that that is going to be a really great pioneering or innovative way to try and address the corruption problem in South Africa as it relates to this COVID spending.
That's fascinating. Thank you very much, Jordan. I don't know if others have had perhaps the belief that similar measures would be necessary, but let me go to Inaya again to talk about the issues of transparency and trust, and also about debt. Don't forget to come off mute tonight.
You know that Lebanon is going through an economic crisis even before the pandemic, and since October 17th, you know, we had a lot of demonstrations protesting against the corruption that is going on in the country. You know, this economic meltdown that we are going through is the result of decades of mismanagement of the resources of the country, with lack of transparency and with lack of governance structures and tools for responsibility and accountability. Everybody has been asking for reforms, even now the IMF and the World Bank, with whom we are having negotiations to have extra funds to activate and to feed in our economy. The Parliament, since I was during our turn in the Parliament, we succeeded during the last months to pass the law for the establishment of the anti-corruption commission, lifting secrecy, bank secrecy on the accounts of civil servants, any institution or body that might be suspected of misusing or abusing the public money. We have the law for that gives citizens the right to access the information. Unfortunately, it is being slowly enacted, but this is part of the reforms that we are planning to do. Of course, we know our debt to GDP before this pandemic crisis was about 150%, maybe second highest in the world or third. But now with the crisis, maybe it's up to 175%. Transparency and anti-corruption tools really have to be taken into consideration. Now in the Parliament, we are discussing a new procurement law that is really in compliance with the best international practices. I myself, when I was Minister of Administrative Reforms 2.5 years ago, I have developed a strategy for anti-corruption with an implementation plan with the support of the United Nations Development Program with 7 excellent pillars. And this government, this actual government, put it into practice, and they should be starting implementing the 7 outcomes that will lead to multi-dimensional, not only preventive anti-corruption programs, but also judiciary with retroactive effect on everybody who has abused the public money. But you know, in all of these things, political will is the key. If we don't have a political will to implement these and to really end this corruption and end the misuse of the resources of the country, already the country is in a very big, serious economic crisis. But this crisis also offers an opportunity for paving the way to a better future when transparency and well-governed management of the resources of the country are in place. We hope so.
We hope so as well, and I thank you for that. It's good to think of it of there being opportunities in the midst of such a difficult time. James, could I turn to you as well? Transparency and debt, both elements of it. I think the trust issue is one that every government faces as well. Do you have any reflections on how those issues are impacting in the UK and inside the Parliament?
Yeah, I mean, the scale and the pace of the which the financial support packages have been put together have certainly caused challenges and scrutiny. And support for businesses, the focus has been on getting money out of the door, getting it to businesses as rapidly as possible. That's been through a mixture of what we call a furlough scheme, so effectively the government paying people's wages for the period of the lockdown so that they didn't lose their jobs. So there's quite well-established systems and fraud measures in place for those. And where there have been gaps amongst self-employed people and some other groups, largely the reason for that is to prevent fraud taking place. That has meant that some people have missed out, but it's been a counter-fraud measure. So I think broadly the transparency has been there. The government sort of come to Parliament to explain its figures. The Public Accounts Committee, we've gone over and sort of calculated the £124 billion that's been paid out thus far and the buckets into which it's been paid. So, and a lot of money for businesses to pick up some of the points about, and particularly in South Africa, a lot of the money that is being paid to businesses is being done by local authorities. So ultimately they will be held to account for the grants of sort of 10,000, 25,000 to businesses. And there are checks in place and there'll be the ability to claw back that money. But the focus really has been to get money to help people, which means that necessarily there's some higher risk from doing that. In terms of debt, I mean, yeah, the UK's national debt is now over 100% of GDP. It's nearing £2 trillion pounds rather. And we've spent the sort of last decade bringing down the deficit and getting the debt under control as well. But in this circumstance, particularly when bond yields are still so low, we can afford to finance this, but we need to get the economy restarted, which is the Chancellor again will be talking today about young people and supporting them in jobs, because there's danger of scarring a generation. So I think broadly the reception to the scale of the government response has been very positive. And whilst there is always that fraud risk, I think we have quite well established mechanisms, and local authorities are used to responding to floods and other crises where they pay out money to businesses and have checks in place.
That's really helpful. Thank you very much, James. Putri, transparency also is a very important issue, I know, in the DPR. Could you say a little bit about how the commitment to transparency has affected the handling of the COVID crisis in Parliament? Has it been helpful? And the debt issues, I know, will be of concern as well. You're on mute still, Putri.
Hello. Okay. Thanks, Anthony. And I want to start with the two major regulations for COVID-19 management in Indonesia. That is the government regulation in lieu of Law Number 1 of 2020 on states' COVID-19 finance policy and financial system stability that was explained by Pak Fadli in his opening remarks. And also the presidential regulations number 54 of 2020 as amended on the 2020 state budget revision. And the revision accommodates law number 2 year 2020 mandate by expanding the state spending to provide for the nation's COVID-19 relief programs. And it funds expansions in healthcare, social protection system, and the national economic recovery programs in the forms of various credit incentives for micro, small, medium enterprises. And it also regulates budget reallocation of several ministries and expansion of budget for leading ministries such as the Ministry of Health. And even though today's condition may require a stronger executive role. It certainly does not undermine the legislative presence. And I sure all of you, all the panelists here believe the same thing. And I think that our committee's approach has been to exercise our oversight role over the government's relief efforts effectively, and that is to ensure that reliefs were provided to those in need quickly, and making sure we upheld the rule of law at the same time, and hence transparency. And for instance, when we discussed the 2021 macroeconomic assumptions of the state budgeting plan, we are focusing on how the state budget can anticipate and provide enough fiscal space to face future market uncertainties. And we also pushed for an alternative financing plan by utilizing existing budgets such as the accumulated budget surplus, endowment funds, unused funds, and before opting for more public debt. And most importantly, we also build strong cooperation with the Financial System Stability Committee, which consists of the Finance Minister, Governor of the Central Bank, head of the FSA, and also head of IDIC to closely monitor the financial situation. And also, the government faces many challenges in the health sector, especially regarding the lack of personal protective equipment and medical devices. And hence, a significant portion of the state budget is diverted toward purchasing these essential items. And under an emergency, the National Public Procurement Agency Regulation number 13, year 2018, allows for a rapid procurement scheme. And the commitment-making officials could select providers to procure goods, or the government could purchase them on its own. And this is certainly a challenge for us, since corruption of medical kits prone to occurs due to the mechanism of rapid procurement for emergency conditions. And I believe that the government also shares this concern and has showcased its commitment to accountability and transparency. And by involving the state's audit board, the Attorney General's office, and the Corruption Eradication Commission in coordination with government's internal auditor to oversee the procurement process from the get-go. While on the Parliament side, there are two aspects that we must focus on. Parliament must ensure that there are no cartels or agreements to determine excessive prices in this procurement. And in addition, Parliament also needs to ensure that the medical devices purchased are of superior quality and comply with WHO standards. And the biggest challenge for oversight function nowadays is that we're unable to check the facts on the ground, and video conference calls, while have been effective and provide enough flexibility to extend communication, have its disadvantages that may compromise the quality of discussion. And to overcome this, the Financial Affairs Committee has been urging and pointing out to the government and the state's audit board for more stringent auditing measures, and especially by enhancing existing auditing strategy through improvements in ICT structure and procedures, and to make up for the limitation in on-site presence during an audit. And finally, we believe that Parliament still needs to monitor government procurement process due to the potential for maladministration and corrupt actions. And if necessary, Parliaments can use the right to express an opinion, the right of interpellation, and even the right of inquiry if there is a serious violation.
Thank you very much, Putri. Now, we only have 10 minutes left, and I know we mustn't forget that our panelists are parliamentarians and there is parliamentary business which is going on as we speak, so we will respect that timing. I think we have time for perhaps one question before any brief closing remarks. And I'm going to ask my colleagues who are helping with the administration of the call to see whether they have received any question that they want to raise. If not, I will ask a question myself. But let's see on the chat if we have any question that's ready. Just looking at my colleagues. Okay, so there is one about the budget process, which I think is specifically about Indonesia and the DPR on handling the budget. So I think we'll keep that one to one side because I want, I think that Putri or Fadlizon could answer that one separately afterwards in response to that question. But let me just ask all of the four panelists plus Fadlizon, if he's still with us, for a last comment. And I think the way I would phrase it would be that we all need to learn lessons from these crisis experiences. If you were thinking ahead to future colleagues in a parliament 10, 20 years from now that had forgotten about this experience, and there was one lesson just focusing on the issue of scrutiny, and particularly scrutiny over the huge economic and financial impacts of the crisis, is there one lesson that you would want to pass on to your future colleagues about the way that Parliament could be as effective as possible, both in helping the government to manage the crisis, but also, well, we're not going to take that question, my colleagues on the administration, we're not going to take that now. I'm just asking the panelists, is there one lesson that you would like to share, particularly on the role of Parliament in ensuring effective financial scrutiny? And I'll start with James, and then Inaya, then Putri, then Jordan, and Fadlizon to finish. So James, please.
Thanks, Anthony. Sorry. I mean, I think there's some practical lessons, which is about the ability of the committee to be present and able to scrutinise government. Picking up on some of the points Jordan was talking about earlier in terms of the Parliament not being able to meet and the inability to scrutinise. I think having practical measures in place to allow that to happen is very, very important for parliamentarians to be able to respond. And I'd hope that the reports that we will be providing will help shape what a good response looks like for future pandemics, and also leads to more. One of the interesting / alarming things that came up in one of our hearings was that there hadn't really been a proper wargaming of a pandemic and the economic response in the way that there had been for the health response. And the health response, obviously, there's lots of lessons to be learned, but at least they had rehearsed, whereas they had to, the government, the Treasury looked back to the 2008-9 crash and the playbook there, which was helpful, but that was obviously more than a decade ago, and in that interim period there wasn't proper preparation. So I think Parliament can play a role in pushing government and coming up with recommendations for how to respond effectively next time around, if there is a next time.
That's really helpful, James. I hope there isn't a next time, but experts may think otherwise. And Dr. Inaya, do you have any lesson that you would like to pass on?
Yeah. Lessons I have learned and we have learned is that we have, I think, in many sectors, the Parliament has to play an effective and active role in regulating so many sectors that have been non-protected and neglected for decades, and that showed that it's very strongly related to our national security and social security, which is agricultural sector and its direct relation with our food system and food security and the health system. For so many times there have been empowerment financially for the private sector at the expense of the public sector. Most of the spending of health by the government was done in the private sector, and this private sector did not respond and did not have the will to respond. So we have to empower the public sector, of course, regulate our relationship with the private sector. And as my colleague, and we would like to see also policies by the government that are more with an approach that is integrated, because they cannot anymore work in silos. And we have seen this equally during this crisis. And we would like to see more technology incorporated in the work of the Parliament with the right infrastructure to allow us to overcome any physical barrier that might happen, that is happening now or in the near future or in the future. And I think this is important for the whole country. There is a lot to be said. The digital gap that has been uncovered between the different parts of the society was terrible. So these are so many lessons we have to learn, and we have to work legislatively accordingly. Maybe we can shape a better future for our kids.
Thank you very much, Inaya. Putri, could I ask you for a lesson or two that you would pass on to your future colleagues?
Yeah, carrying out oversight function is certainly challenging when our movement and on-site presence are limited. And however, we believe that collaborative efforts, as Inaya has mentioned, between all standing bodies within the parliament are the key to a resilient parliament. And in the House Commission 11, we have maintained strong communication and shared perspective with the government, central bank, FSA, and audit board that any policies passed must have the capability to prevent a second wave, or at the very least to minimize its impact to our financial stability. And in overseeing the government spending, we have conveyed the utmost importance of accountability and transparency in managing the state budget. And we urge the government to create a cohesive and holistic set of regulations which enables them to enact the extraordinary times legislations coherently with other existing mechanisms, especially pandemic response programs such as the economic stimulus and expansion of social safety net. And also this program should be supported by effective infrastructures such as the integrated recipient data and reliable disbursement mechanism. And having learned lessons on many challenges of COVID-19 pandemic management, one of the most important takeaway for us in the DPR is to plan out ahead for the post-crisis financial affairs, especially in terms of fiscal risk management. And I think the future policies must be able to maintain its fiscal space and fiscal sustainability to allow room for immediate relief without adding extra costs. And in the short run, our homework is clearly to oversee the gradual decrease of state budget deficit back to its standard, which is from 6.34% of GDP in 2020 to below 3% by 2023, and as mandated by the law. And hopefully by maintaining this discipline, we can sustain public debt repayment to not become a burden for future generations, my generation and the future to come, or threaten the country's economic growth by burdening the state budget.
Thank you very much, Putri. That's helpful. Jordan, could I ask you as well, before turning to Fadlizon for the last word on this, for lessons that you would want to share with your future colleagues?
Yes. Right, there we go. I realize we're very tight on time, so I'll keep it brief. I would just say, Anthony, that I think it's a great point made about modeling this for the future and doing some kind of war game scenario planning. And if I took one lesson from it, I think that it is natural in a time of crisis for people to look to the government for leadership and to assume that that they've got things covered. And I don't think that is an assumption that Parliament should ever make. And Parliament should assert itself and its oversight role from the very first day, and realize that Parliament and holding the government's response to account is an essential part of the crisis response. It is not just up to the Department of Health and the government authorities and the executive to respond to a crisis, but Parliament's role is just as essential in responding as everyone else's.
Jordan, that's an excellent lesson to leave us with. And Fadlizon has kindly suggested that in light of time, he doesn't make further comment. I will therefore just end by thanking our fantastic panelists for a really helpful and interesting discussion. Thanking Fadlizon, our co-host, and his committee for working together with us on this webinar. I think what I have heard is that the crisis has exposed vulnerabilities that have existed in some of our societies and all of our societies around the world, that parliaments have a critical role both in supporting an effective response, but also scrutinizing the effectiveness of the government's response, and that we can all do a better job in thinking about and planning for future possible crises to ensure that we do the best we can with public resources to address them. So I'll end with that, thanking you all very, very much for your participation, and hope that you all stay safe and well, and that we can see each other again in person before too long. Thank you very much, everyone.
Thanks, Anthony. Thank you, everyone else.
Thank you, Anthony. Thank you, everyone.
Thank you very much. Thank you.
Bye-bye.
Bye. Bye.